So, for this lecture, pinili ko yung mga high yield na mga topics, lalo na based on feedback from the previous examiners. So we might not be able to cover all, but hopefully you will be able to retain better yung mga nabasa nyo na and napanood nyo dun sa main video na more high yield topics. Okay, so huwag nating kakalimutan na aralin yung legal med juris and ethics kahit na mas maikli siya or mas hindi siya may notion na hindi siya ganun ka-relevant, but take note, 'di ba? Equal lahat sa mata ng Board of Medicine. Lahat ng subject equal 'yan, 100 items 'yan. And lahat kung hindi ka umabot dun sa cut-off na 50%, hindi ka papasa ng board. So, give equal importance. Okay, so let's start. So, legal medicine, remember that legal medicine is a branch of medicine, while medical jurisprudence is a branch of law. So, legal medicine is medicine applied to law. So, kung ano man yung matutulong natin as doctors to the implementation of the law, that's legal medicine. Medical jurisprudence, law applied to medicine. So, remember that we as practitioners are still under the law of the Philippines. So, it's study of rights, duties, and obligations of a physician, specifically those arising from the doctor-patient relationship. So start tayo sa medical jurisprudence and dun sa physician-patient relationship. Remember that the physician-patient relationship is contractual and based on mutual respect and trust. So what are the instances that there's no physician-patient relationship? So pag pre-employment physical exam, pag physical exam for insurance, kapag appointed lang yung physician by a trial court to examine the accused during autopsies, or yung karaniwan nararanasan natin, casual questions in an ordinary place, so reunions, nag-message lang bigla sa Facebook, or nasa labas lang kayo, nasa gala. So yun yung mga instance na walang physician-patient relationship. And important na malaman kung kailan yung instances na wala. Kasi pag meron, dito mag-a-apply yung duties and obligations natin as physicians. So these are to possess the knowledge and skill of an average physician. Remember, average. Use this skill and knowledge with ordinary care and diligence. So ordinary lang. Exercise best judgment and observe utmost good faith. So basically, ang duty at obligation natin ay average lang, yung skills, knowledge, pero yung judgment natin, yung pagiging tao natin dun sa mga pasyente, dapat laging best foot forward tayo. And remember that in the terms of the relationship, it only states that the physician will render medical service. So hindi ni-imply na maging successful yung treatment, maging beneficial siya, produce a certain result, not harm the patient, or that the physician will not commit errors in an honest way. So unless sabihin mo mismo, you as a physician, sabihin mo dun sa pasyente na gagaling ka dito sa gagawin natin, yung baseline lang na terms ay will render medical service. So huwag niyo ilalagay yung sarili niyo sa alanganin by saying something like hindi makaka-harm yung treatment, mga ganun. So what are our rights as physicians? So we have two kinds. You have the inherent and incidental rights. Sa inherent right, we have 4: the right to choose patients, the right to limit practice, determine appropriate management procedures, and to avail of hospital services. Important yung sa right to choose patients. Tandaan natin na laging meron yung right na yon, except in emergencies. So kapag may emergency, kailangan mag-respond. Give first aid, then tsaka mo i-refer kung hindi talaga kaya. But if there's a threat to the physician's life, may not respond. So kunwari may nasusunog na building tas nandun yung pasyente nag-collapse, pwedeng hindi ka mag-respond. But if the threat to the life is more of a epidemic, kunwari during COVID, if it's during an epidemic tas may emergency, kailangan pa rin mag-respond. So baseline, may right to choose patients except in emergencies and except during epidemics. Dun sa incidental rights naman, we have 6. You have the right of way while responding to the call of emergency. And remember na yung right, you may violate minor traffic rules. So kunwari, beating the red lights, swerving, yung mga ganon. Pero kapag may major traffic rule kang nilabag, liable ka pa rin dun. you have the right to exemption from execution of instruments in library, right to hold certain offices. So maging DOH secretary, maging member ng Board of Medicine, municipal health officer, etc. Right to compensation, right to membership in medical societies, and right to perform certain services. So kung may rights tayo, meron din tayong mga liabilities. So what are our liabilities? So we have three kinds. You have criminal, civil, and administrative. So, important yung tips to remember para lang may mading tandaan kapag inisip niyo siya. So, criminal, gusto ka makulong. Civil, gusto ka magmulta. Administrative, gusto ka alisan ng lisensya. An important thing to note is the level of evidence needed for conviction. Yung nakalagay sa handout, 'di ba, para yung mga grades. So, yung highest grade na kailangan mo maabot para ma-convict yung isang tao ay nasa criminal liability. Kailangan, sure na sure ka. Guilt beyond reasonable doubt. Kasi, di ba may saying nga, it's better to let a guilty man free than to put an innocent man in jail. Civil yung sumunod, preponderance of evidence. So ano ibig sabihin ng preponderance? It means weight. So pabigatan ng evidence. So may dalawang sides, yung kinasuhan, tsaka yung nagsampa ng kaso, pabigatan sila. Tapos kung sino yung mas may mabigat na evidence, siya yung mananalo. Pag administrative, kailangan lang ng substantial evidence. So basta merong talagang proof na may nangyari, may ginawa yung physician, liable na siya. So penalties, remember, fines are for criminal, damages are for civil. Damages are also monetary. Okay? And administrative, ito yung ini-issue ng Board of Medicine through the PRC. So warning, reprimand, suspension, revocation. Okay? So, what are the grounds for reprimand, suspension, or revocation of registration certificate, yung lisensya natin? It's based on the PMA Code of Ethics. So, lahat yan, pag ginawa natin as physicians, pwede tayong maging administratively liable. So, kasama dyan, ano ba yung mga important dyan na manote? Fraud in the acquisition of the certificate of registration, syempre. Addiction to alcoholic beverages or to any habit-forming drug. Even gambling. Ano pa? False or extravagant unethical advertisements, knowingly issuing any false medical certificate, issuing any statement or spreading any news or rumor which is derogatory to other physicians without a justifiable motive. So, important tong ma-differentiate ano yung derogatory statement. Tanong tawag sa kanya kapag in writing, it's called libel. Kapag sinabi siya, it's called slander. Okay? Yeah, so yun yung mga grounds for administrative liability. And another thing na very important is yung media exposure nga. So, di ba, false extravagant advertisements, hindi yun ethical. So, media exposure, tandaan natin na physician involved in media must be well informed of the subject matter under discussion. And ito lang yung mga kailangan nakalagay pag mag-a-appear ka. So, name, membership to society or institution. Yun lang. So kapag naglagay ka ng anything else, yung mga awards mo, accolades, unethical na yun. Pwede ka na maging administratively liable. Kailangan articles written by physicians are evidence-based. And ito important, physicians must disclose any potential conflicts of interest if relevant. So kunwari nagsasalita ka about this disease, tapos noon magpo-promote ka ng drug, tapos yung drug na yun tapos apparently doctor ka rin nung pharmaceutical company making that drug. So kailangan mo i-disclose yun na part ka nung gumagawa ng drug na yun. And MD shall not commercially endorse any medical or health products. So let's talk about doctrines. So doctrines are the ones used in civil cases. Remember that doctrines are not laws, but they're just used as a guide para malaman kung for preponderance of evidence. So civil liabilities to. So we have doctrine of vicarious liability. So it's the responsibility of a person who is not negligent for the negligence of another. So hindi ikaw yung may kasalanan, pero ikaw yung responsible. It's also known as your doctrine of imputed negligence or doctrine of respondeat superior. So if an employer-employee relationship is established, the negligence of the employee is conclusively the liability of the employer. And nag-apply siya sa hospitals natin. So kung employed ka ng hospital na doctor, nagkamali ka, liable din yung hospital. And remember that there are sub-doctrines. under the vicarious liability doctrine. So you have the ostensible agent, borrowed servant, and captain of the ship. So yung ostensible agent, ito yung mga pathologists, radiologists, and anesthesiologists. So kahit na independent contractor sila, employed silang hospital. So liable pa rin yung hospital for their negligent acts. Road servant, minsan, di ba, yung employees of the hospital are under the supervision and control of another. So kunwari, may consultant. Binaro niya yung service ng residents and interns. Kapag nagkamali yung resident and intern under the direction of the consultant yung magiging liable. And lastly, you have the captain of the ship. Sikat na sikat to sa OR. So yung surgeon is the captain of the ship, and any negligence or wrongdoing na mag-occur in the operating room, yung head surgeon yung responsible. So kahit yung magkamali dyan ay intern, another specialist, like an anest or yung mga nurse, siya pa rin yung liable, yung head surgeon. You also have the doctrine of res ipsa loquitur, or the common knowledge. So the nature of the wrongful act is suggestive of negligence. So kahit wala ka, hindi mo kailangan ng expert opinion. Alam mo pa lang na, nakita mo pa lang yung scenario, alam mo na may nangyaring mali at naging negligent yung taong may kasalanan doon. So there's no need for an expert to enlighten the case. You also have the doctrine of contributory negligence. So ito naman, the conduct of the plaintiff or yung nagsampa ng kaso contributes to the harm they have suffered. So in our instance, basically, mayroong ginawa yung pasyente or may behavior yung pasyente na nag-contribute sa damage, sa harm na na-suffer niya. For example, failure to give MD an accurate history. So hindi sinabi ng patient na allergic pala talaga siya sa ganito gamot, tas binigay, tas nagkaroon siya ng reaction. Failure to follow treatment, leaving hospital against the physician's advice, and failure to seek further medical assistance if symptoms persist, yung mga ganyan. But counter to that is the doctrine of superior knowledge. So the physician has superior knowledge over their patient. So kunwari yung mga bagay na yun, allergy sa gamot, kailangan sure yung doctor na natanong niya, kasi yung doctor yung may alam ng consequences. Kasi kung hindi na kung nabigyan ng gamot na allergic yung patient, yung doctor yung mas may alam. Thus, with this doctrine, the doctrine of contributory negligence is not frequently applied in medical professional liability cases. Next, you have the doctrine of foreseeability. So the physician feels then the condition of a patient is liable to injury sustained. So hindi kasama dito yung mga force of nature na mga events. So ang example dito is not raising the side rails of a pediatric patient, nalaglag yung bata kasi malikot, fall and contusion, liable yung doctor. Or may suicidal patient nilagay sa second floor or at least basta mataas na floor ng building, tas may bintana, tumalon. So liable yung doctor. Question, what if may earthquake tapos biglang nabagsakan yung patient ng electric fan, gano'n? Yun, hindi na yun kasalanan ng doktor kasi force of nature, hindi naman yun, wala yun sa foreseeability. Okay? You also have the fellow servant doctrine. So if an employee was injured due to the negligence of a fellow employee, then the employer cannot be held liable. So kung may residente, accidentally na saksak niya yung fellow resident niya, siya yung mananagot. So this is covered by your labor laws. And lastly, you have the rescue doctrine or the Good Samaritan law. So marami siyang elements. So if a physician is injured responding to a victim, the wrongdoer is also liable. If a physician fails to respond in an emergency without a risk of harm to the self, they may be held liable. And the physician is not liable for any injury in the course of rendering gratuitous service in an emergency. So kunwari, nag-CPR, nabalian ng ribs, nagalit yung patient, pwede dademanda daw niya yung doctor. So pwedeng gamitin tong rescue doctrine na hindi liable yung doctor kasi nag-render siya gratuitously ng service and it was an emergency. So doctrines, civil liability, you are found guilty, tas may liability ka na. So so papagbayarin ka ng damages. So what are the types of damages? So dito nilista ko na siya, from highest to lowest, yung exemplary to nominal. So you have exemplary or corrective. It's usually awarded in medical negligence suits to deter other doctors from doing the same. So kaya siya exemplary or corrective. May gusto kang i-correct na behavior or act. You want to set an example of that doctor. Next, you have your actual or compensatory. So adequate compensation siya for pecuniary or monetary loss suffered by a person. So pwede siyang direct. So so kunwari yung naputulan ng kamay, so, na yung hospital bill niya for that. So yun yung direct. Tapos yung mga indirect costs, so kasama dyan yung nawalan siya ng trabaho, magkano yung loss of income, etc. So part yun na actual or compensatory damages. You have temperate or moderate. So ito yung more than nominal but less than compensatory. Then you have nominal wherein may onti lang na binigay dun sa plaintiff or dun sa nagsampa ng kaso kasi nare-recognize ang court na meron namang maling ginawa pero wala namang bad intention. Basta nare-recognize na may breach of the duty of the defendant or yung sinampahan ng kaso. So kunwari, yung example dito, during an XLAP for a different condition, tinanggal na rin yung appendix. Yung mga ganun. May nominal damages usually ina-award doon. Next, you have moral damages. So moral damages, ito yung mga for harm or injuries na hindi madaling i-quantify. So physical suffering, mental anguish, fright, anxiety, social humiliation, yung mga yan, mag-award yan ng moral damages. And pag liquidated, meron nang naka-agree upon yung parties. So nakalagay, kapag may breach of contract ka, ganito yung babayaran mo. So liquidated damages yun. So yun yung sa doctor. Let's go to the patient. What are the rights of a patient? So first, you have these 8 rights na nakalagay sa handout. So first, you have the right to give consent. So remember that for it to be a valid consent, it should be informed, it should be voluntary, and the subject matter of the consent should be legal. And there are 2 forms. You have expressed and implied. So kapag expressed, outright, sinabi talaga, whether written or oral, na meron talagang terms yung physician-patient relationship and may consent talaga yung patient. Kapag implied, it's deduced from the conduct or non-objection of the patient and or their relatives. So kasama dito yung mga emergencies. Walang kaya magbigay ng consent, kunwari, nasagasaan randomly sa kalsada, tas may doktor, ganun. Since walang kaya magbigay ng consent, hindi kaya rin yung patient magbigay ng consent, yung physician pwede mag-provide na any treatment deemed necessary and the consent is already implied. So, who can give consent? So, etong table, nakasummarize na kung sino yung kaya magbigay ng consent if 1, the person is of legal age, and 2, if the patient is a minor, less than 18 years old. So basically, you should lagi yung patient kapag legal age. Then, spouse, dapat legitimate. So kung kunwari common law or live-in, hindi counted yon. Then descendants, so mga anak, then ascendants, then collaterals, so parang down, then up, tapos nun yung mga katabi, siblings, then tsaka pa yung nearest of kin, then the legally appointed guardian, tapos kung walang-wala, yung government. Kapag minor, syempre, parents yung una. Ngayon, like the clarification earlier, kung may disagreement, tapos legitimate yung anak, father yung consent. If illegitimate or less than 7 years old, mother ang magbibigay ng consent. Lalo kapag may disagreement. Then you go to paternal grandparents, then maternal grandparents. So tsaka pa lang yung mga siblings. Then guardians, teachers and professors, etc. Next, the right to give to confidential or privileged information. So we have 2 types, and this small comics generally explains kung ano yung ibig sabihin niya. Kapag statutory privileged communication, a physician cannot be examined as to details of a case, lalo na kapag regarding information na nakuha niya while being a doctor of that patient. So remember, civil case. So ang statutory privilege communication, meron ba siya kapag criminal case? Wala. So pag civil case siya. Then you have your ethical confidential information. So ito, yung hindi ka pwedeng magsabi about a patient or anything that you've learned about the patient during your time handling that patient to other people. Hindi mo pwedeng magkalat ng information. Protect the patient's privacy. Okay? So, the definition of privileged communication, the witness cannot be examined regarding information that was originally communicated to them during a professional or confidential relationship. And remember that the physician-patient relationship is a professional and confidential relationship. Ano pa yung examples ng ganong relationship? Spouse and partner, lawyer, their secretary, clerk, stenographer, and the client, a minister or priest, lalo na during confession, or if it's a public official, kasama sila. So exceptions again, criminal proceedings kasi civil cases na nag-a-apply, and of course in the interest of public health, justice, and public safety. And most likely criminal case yung mga yan. So aside from that, you also have the right to disclosure of information. So hindi ka pwede mag-withhold ng mga records from patients basta may hingin nila, dapat bigay. Right to choose their physician, especially in private settings. Pag public, medyo wini-waive yan. Na-waive tong right na to. You also have right to privacy, right to religious belief, yung napag-usapan kanina sa clarifications, right to treatment, and the right to refuse necessary treatment. Remember that the right to refuse necessary treatment is not equal to the right to die. Hindi legal ang euthanasia, ang active euthanasia dito sa Philippines. Let's go to the medical witness. So a doctor can be called to become a witness to a case, and the process to cause a witness to appear before a court is called a subpoena. So either magbibigay ka ng testimony or they're gonna ask you to produce evidence. So failure to comply without justifiable reason is grounds for reprimand, suspension, revocation of license. So kapag ad testificandum yung subpoena, testificandum, testify, testimony. Kapag duces tecum, documents, duces tecum, documents. Tapos kapag both, yung duces tecum et ad testificandum. So kailan pwedeng hindi mag-comply yung physician sa subpoena? When the issuing court has no jurisdiction over the subject matter, when the place of residence is more than 50 kilometers. And again, ito yung mga nuance ng legal medicine na subject. Noong 1997, in-increase siya to 100 kilometers. So hopefully, pag natanong to sa boards, hindi both mag-appear. And kailan pa? In civil cases, when transportation and other expenses are not given by the party requesting of their presence. So, kunwari, ayun. Basically yun, kung hindi bibigay nung, kunwari, plaintiff yung nag-request sa doctor na pumunta ka, tas hindi sila nag-provide ng, ng transportation, ay ng pambayad sa transpo or other costs, pwede hindi ka pumunta. Kailan pa? When the physician is attending an emergency and no one else is available and competent enough to be their substitute. So medyo mahirap i-justify ito. Depende na lang siguro sa setting. Kung dito ka sa Manila, parang mahirap yung gamiting reason. And when a physician is suffering from an infirmity, which will be aggravated if they comply with the subpoena. So, di ba, kapag hindi ka nag-comply sa subpoena, pwede kang grounds siya for administrative liability. Pwede ka ring ma-cite for contempt. And contempt is being disobedient or disrespectful to the court of law and its officers. So, direct and indirect. Pag hindi ka, ang direct contempt committed inside the court. So, kunwari, sinuntok mo yung judge. Yun, direct contempt yun. Indirect contempt kapag outside the court. Hindi ka nag-comply sa subpoena, that's indirect contempt. Let's go to the practice of medicine. So, the practice of medicine is regulated by three regulatory bodies. You have the Board of Medical Education, the Professional Regulation Commission, and the Board of Medicine. So, familiarize yourself with the roles and functions of each. So, basically, yung function really corresponds to their roles naman. So, Board of Medical Education, so it's about medical education, standardization of and regulation. So ano yung mga requirements para makapasok ng College of Medicine, ano yung mga kailangan sa curriculum, etc. PRC, it's really for administering and conducting of the licensure examinations for physicians. And for the Board of Medicine, so sila yung talagang nag-regulate ng practice of medicine and to discipline licensed physicians. So kasama dyan yung pag-prepare ng contents ng licensure exam. So sila yung gagawa ng content, PRC yung mag-administer. Kasama yung pag-issue ng subpoena and conduct investigations on complaints regarding doctors. Tinatanong din minsan, members ng regulatory bodies. So, Board of Medical Education, a lot of them are related to medical colleges. So, remember that the chairman is the Secretary of Education. So, hindi yung Secretary of Health. Kasi, basically, education pa rin yung focus eh. So, Secretary of Education, kasama dyan ng DOH Secretary, private schools, Board of Medicine, kasama din, representative ng PMA, dean ng UP College of Medicine, representative sa Philippine Medical Schools, and representative ng Philippine Medical Colleges. Another important thing siguro yung Board of Medicine. So remember, 6 members sila appointed by the Philippine President. So President ang nag-a-appoint sa kanila. At pinagbabasehan ng President ang isang list given by the Executive Council of the PMA. But take note na pwedeng mag-appoint yung President ng kahit sino gusto niya. Kahit wala siya dun sa list. Tapos ito yung mga requirements, ito yung mga qualifications. So 'di ba? Right of a physician to hold certain offices. So kailangan physician ka para maging part ka ng Board of Medicine. Let's go to the actual practice of medicine. What are the prerequisites to practice medicine? Tandaan lang natin yung tatlo. Ito yung tatlo yung pinaka-important. Age must be greater than or equal to 21 years old. You must have passed the board examinations, and you must be a holder of a valid certificate of registration. So, diyan napapasok each of these prerequisites. Diyan napapasok yung mga nitty-gritty. So, kunwari, pass the board exams. Ano yung mga qualifications? So, kunwari, kailangan citizen ka of the Philippines or citizen ka ng isang country na may reciprocity. Diyan din papasok yung good moral character. Kasi 'di ba, basically para ang part ng prerequisites, tandaan niyo yung mga requirements na pinapasubmit sa inyo para makapag-board exams. Kailangan niyo ng certificate of internship, 1 year, kailangan ng certificate of good moral character, kailangan yung transcript of records, kailangan natapos ka ng holder ka ng degree of MD, etc. And yung last again is the holder ka ng valid certificate of registration. So hindi porke pumasa ka na ng board exams, pwede ka na mag-practice ng medicine. Kailangan mo actually hintayin yung license. And kasabay dapat kasi nung license, yung certificate of registration. So meron yan nangyayari na after ng boards, ang tagal kasi ng PRC magbigay ng license, nagpa-practice na sila. Technically illegal yun. So what are the acts considered practice of medicine? So yung first item, basically, ang sinasabi niya, fee for yung SOPIME or ISOPIME. 'Di ba? Yung introduction, subjective, objective, assessment, plan, implementation, monitoring, evaluation. So pag binayaran ka or na-compensate ka for doing that, that's already practice of medicine. Kasama din yung advertisements. So pag sinabi mo sa advertisements na nagpa-practice ka ng medicine, counted as practice of medicine, and those who shall use the title of MD after their name. So what are those acts that are not considered practice of medicine? So any medical student enrolled in the medical school or graduate under training, basta under direct supervision ng registered physician. So kung hindi licensed pala yung nagtuturo sa'yo, ayan, baka illegal yun. Illegal siya, pero baka hindi rin naman siya practice of medicine. So any person rendering service gratuitously in cases of emergency. So kunwari may civilian sa isa. So kunwari may office building, may civilian, nag-collapse, yung coworker niya, mayroon silang AED dun sa office nila. Ginamit nung civilian yung AED kasi may instructions naman yun. So technically, hindi yun practice of medicine. Any person who administers household remedy as per classification of existing pharmacy laws. So kunwari, household remedy, kunwari, nag-warm compress ka lang, cold compress, binigay mo sa isang tao, yun counted as practice of medicine. And of course, yung other duly registered healthcare professionals within the scope of their field. So dentists, pagtungkol lang sa ngipin or mga associated complications dun sa area, mga physiotherapist, usually physiotherapist, clinical psychologist, prosthetists, usually kailangan merong prescription or written order from a doctor para gawin nila yung ginagawa nila. Yan. So, yung mga yan, basta limited to the scope of their field, hindi siya considered practice of medicine. And meron din tayong tinatawag na limited practice of medicine. So, Kasama dito yung mga physicians from other countries, basta may authorization from the Board of Medicine. So attached to international bodies. So kunwari yung SMILE, yung Operation SMILE, yung mga nag-operate on mga cleft lip and palate, yung mga ganun. Commissioned medical officers of the United States Armed Force stationed in the Philippines. So basta nandun sila sa territorial jurisdiction nila. Foreign physicians employed as exchange professors, pwede rin, limited lang. So hindi lahat pwede lang gawin. And eto, medical students who have completed the first 4 years of medical course, so hindi kailangan natapos mo yung internship, graduates of medicine and registered nurses, pwede under the directive of the Secretary of Health during epidemics or national emergencies. And actually, kung naalala nyo, nung pandemic, nangyari to. Nag-release yung DOH Secretary na pwede, yung mga graduates, para lang makatulong sila dun sa pandemic. Okay? So, another thing to take note dito sa mga prerequisites to the practice of medicine, etc., based to sa Medical Act of 1959. Okay? So, last topic for MedJuris, referrals. So, there's a the PMA, Code of Ethics, has a few statements regarding referrals. And just to highlight, the primary and consultant physician should always observe the proper protocol. So depende siya dun sa mga institutions kung ano yung setup nila. The consultant may make another referral but should seek permission from the primary physician. Remember that in making a referral, kailangan may clinical abstract at kailangan nakaspecify kung bakit siya i-refer at kung ano yung kailangan dun sa referral. And the physician shall not receive any commission for referring patients to a colleague, third person, or institution. So, hindi pwedeng bigyan ka ng pera dahil ni-refer mo yung patient mo dun sa isang colleague mo. However, nominal gifts during occasions may be received by a physician. So, this is based on the PMA Code of Ethics. So, that's it for medical jurisprudence. Let's go to legal medicine. So again, legal medicine, it's medicine applied to law. Okay, so let's talk about medical evidence first. And we have different types of medical evidence. So you have autoptic or real. These are those perceived by the senses. Testimonial, so whether oral or expressed, under oath. It's given orally and it's expressed under oath. So you can be an ordinary or expert witness as doctors. Experimental, nag-perform ka ng actual experiment in front of the court to prove a point. Documentary, so basta nag-present ka ng document. So any instrument na ginawa for the purpose of recording. Physical evidence are any articles and materials found in connection with the investigation. Physical. Basically physical. And kung tutusin, actually, yung autoptic or real, yung mga physical evidence, counted siya as autoptic or real kasi nape-perceive siya ng senses. So what are the other different types of physical evidence? You have corpus delicti. These are objects or substances that are part of the body of the crime and they prove that the crime existed. Kapag associative, na-associate mo, meaning nalilink mo yung suspect to a crime, and kapag tracing evidence, you can trace the suspect. So, nakakatulong siya para ma-locate yung suspect. And criminalistic evidence, so ito na yung application of sciences in crime detection. And these are the modes of presentation of physical, modes of identification, collection, preservation, and presentation of physical evidence. So, identification. So it's the determination of the individuality of a person or thing. Important siya kasi pwedeng may nagde-deny ng identity, connection ng, may missing person, may nahanap na katawan, siya ba to? Ayan. Or for legal error purposes. Kasama sa identification yung height approximation. And unfortunately, tinatanong tong height approximation. So, yung usual na ginagamit ay highlight naman. So, 8 times the length of the head. Ano pa ba? Distance between the tips of both middle fingers with the arms extended laterally. And yan, twice the length from the vertex of the skull to the pubic symphysis. So, personally, mahirap talaga siyang i-memorize. Pero it helps if you're a very imaginative person or if you have a visual guide. So, dun sa handouts, meron dong picture. Pero ito, ginawa ko may animation. So, ito yung sample. So, hindi siya super perfect. Kaya, approximation siya. So, di ba 8 times the length of the head. So, yan. Length of the head, 1, 2, 3, 4, 5, 6, 7, 8. Pwede na. So, yan. 8. So, 8 times the length of the head. Next, twice the distance ng vertex of the skull to the pubic symphysis. So, yan. Yung blue shaded area, yan. So, pag dinoble natin siya, boom! Approximated the height. And yung isa pang madaling i-imagine, yung distance ng middle finger, yung tips of the middle fingers extended laterally. So, yan yung distance. Boom! Yun. So, na-approximate mo na yung height. So, kunwari, walang legs yung nahanap na katawan, kaya mo pa rin dapat ma-approximate yung height. Next, dental identification. So, tinatanong ba talaga to? Again, yes. And kailangan ba kabisaduhin? Depende. So, for these types of scenarios, it would be best to employ your most effective method of memorizing or understanding information. So let's put this into practice. So you're given this table and this diagram. So let's try to find patterns. So yung unang lalabas daw si first molar sa gilid. Tapos si central incisors sa gitna, then si lateral, then si first bicuspid, then si second bicuspid. Teka, so parang yung nangyayari is from medial to lateral ang paglabas. Ang exception lang ay si first molar, nauna siya, and yung canines. Ngayon, paano natin tatandaan na si first molar ang una? So pwedeng FM, first mauna. First na nga, mauna pa. So dahil mauna na si first molar, after ni second bicuspid, si canines naman. Then second and third molar. Age is just in increments of 1 except si third molar and yung or third molar also known as our wisdom teeth. So from first molar na 6, central 7, 8, 9, 10, tapos K9, wala na si first molar, tapos na-skip si K9s, 11, then second molar is 12, 11 to 12, then yung third molar, 18 years old. So isipin na lang na, pag 18 na tayo, nagkaka-wisdom daw tayo. Ayan. So, babalik tayo sa tanong, relevant ba to? Maybe, maybe not. But one way to look at this type of information is how you would develop your own effective strategies to understand and memorize these types of concepts. Okay? So yan, di ba? Medial to lateral. And pagdating sa age, so kapag actually pag binilang mo yan, nagko-correspond siya dun sa ilan yung lumabas na permanent teeth. So at 9 years old, you have 12 kasi meron kang 8 incisors and 4 molars. Tapos masasama na at 11 years old yung premolars mo, kaya madadagdagan ng 8. Then by 13 years old, you have 28 kasi masasama na yung canines. And masasama na yung other molars. Yan. So, next, let's go to sex crimes and crimes of chastity. And this table summarizes the different sex crimes. So remember that carnal knowledge is the act of a man in having sexual body connection with a woman. So based on law, the old law, to be exact, kapag sinabing carnal knowledge, or sa revised penal code to, kapag sinabing carnal knowledge, kailangan lalaki na gumawa sa babae. And what is sexual bodily connection? It's the slightest penetration in the sexual organ of the female by the sexual organ of the male. Slightest penetration. Yun lang yung kailangan. And yun yung difference niya ng rape dun sa other sex crimes. Kasi sa seduction, ang kailangan sexual intercourse talaga. Crudely, kailangan may full penetration, etc. As in may actual na act. Lalabas, papasok, ganun. So, yun yung difference ng carnal knowledge sa sexual intercourse. And then you have your acts of lasciviousness, which include any act which tends to excite lust. So yung examples na nakalagay dyan sa handout, like fondling of the breasts, rubbing of the genitals, making a person strip, yung mga ganon. So, consider yung acts of lasciviousness. And yung mga requisites na nakalagay dito, again, this is still based on the revised penal code. Hindi pa kasama dito yung anti-rape law of 1997. Hindi pa rin kasama dito yung pag-raise ng age of consent last year. So, tandaan lang natin na ang binago ay from 12 ginawang 16. So, hopefully, madaling malaman sa actual boards kung alin yung basis nila. So for rape, any offended, kailangan woman. Ito pa yung difference sa Solis, nung sinulat yung Solis, nung wala pang anti-rape law, kailangan woman yung sa rape. Tapos any of the following, force or intimidation, woman is deprived of reasons or is unconscious, and the woman is less than 12 years old. So again, kapag ngayon, 16 na. For simple seduction, the offended party is a woman, 12 to 18 years old, and there's use of deceit. Again, kapag bagong law or updated, kung updated yung Board of Medicine or yung tanong, 16 na. Pag ordinary qualified seduction, kailangan virgin. So, yun yung qualified. So, parang may qualification. Dapat virgin. Tapos, committed by a person who shall be entrusted with the woman seduced. Hindi ko alam kung accurate na analogy. Pwede nating isip or hindi. Baka kasi mas rape yun. Pero kunwari na lang, yung nangyari yung sa dulo ng No Limit Angel, di ba si Maria Clara tsaka si Padre Salvi. So pwedeng ganun kasi abuse of authority and confidence, in-entrust siya kasi nilagay siya sa kumbento, ganun. Next, you have incestuous qualified seduction. So kapag incestuous qualified, hindi kailangan virgin and pwedeng more than 18 years old. Basta may blood relationship, sexual intercourse, use of deceit, incestuous qualified seduction. And acts of lasciviousness, basically para siyang rape pero hindi carnal knowledge. Kasi iba lang yung act. So any act which tends to excite lust yung ginawa. Kasi use of force or intimidation, deprived of reason, unconscious, then less than 12 years old. Pero sa acts of lasciviousness, automatic, can be of either sex. So, yun, for the purposes of taking the exam, take note kung yung hinahanap nila ay new or old laws. And you have your crimes of chastity. So may dalawa, you have adultery and concubinage. So remember, pag adultery, ang offender yung wife, kapag concubinage, yung offender ay yung husband. Tas yan yung requisites or elements. Okay? So let's next go to the sexual abnormalities. So marami to. Pwedeng yung as to choice of sexual partner. And nagtatanong talaga sila ng mga ganito. And pagdating dito, very useful yung stock knowledge or broad general knowledge ng mga Latin prefixes, ganon. Infantosexual, desire to an immature person. Pedophilia, sexual desire towards children. Bestosexual, beast towards animals. Bestiality is yung actual act, yung having sex yung towards animals. Autosexual, self. Geronto, elder. Necrophilia, dead, corpse. Incest ay blood relation. As to sexual urge, meron kang oversex. So satyriasis, satyrs, lalaki yung mga satyr. Nymphomania, nymphs are females. Meron ka ring undersex or sexual frigidity. Meron ka ring ways of sexual satisfaction, oralism, use of the mouth, so fellatio, cunnilingus, analism. You have sadomasochism, you have fetishism, tribadism, oppressophilia, urolagnia, coprolagnia, yan, mysophilia, feces, Pygmalionism. So kung alam niyo yung Greek myth ni Pygmalion, yung gumawa siyang statue tapos tama ba? Si Pygmalion ba? O basta may statue involved tapos nabuhay dahil na-in-love siya sa statue, binuhay ni Aphrodite. Yan. Kaya sexual desire towards statues. Mannequinism, mannequins, narcissism, self. As to part of body, you have sodomy, urinism, frottage, partialism. Ito, as to visual stimulation, tinatanong scoptophilia or mixoscopia, watching couples. Yung difference niya sa voyeurism, it's compulsion to peep or to see persons undress or perform sexual activities. Kapag mixoscopia or scoptophilia, watching couples. And then as to number, troilism, it's sexual perversion in which 3 persons, so kailangan 3, trois, kasi un, deux, trois. So 3 persons, troilism. Pag pluralism, group of persons. And you have others, coprolalia, Don Juanism, and exhibitionism. So those are for sex crimes, sexual abnormalities. So for death, now let's go to death. So types of death, you have brain death and cardiorespiratory death. So pag brain death, there's deep irreversible absence of electrical brain activity. And may 2 protocols or two bases kung paano masabi na may brain death. So it's the Harvard Report and the Philadelphia Protocol. Yung cardiorespiratory death, basta tumigil na yung heart and lungs. So yung Harvard Report and Philadelphia Protocol. So sa Harvard Report, may 4 siyang elements. So unreceptivity and unresponsibility. Tapos no movements or breathing, no reflexes, and flat yung EEG. Ngayon, mas marami sa Philadelphia Protocol, pero actually, pag tinignan mo, medyo lang naman of responsiveness to internal external environment, no spontaneous breathing movements, etc. Ang pinagkaiba talaga nila, yung biggest difference is sa Philadelphia Protocol, meron silang falling arterial pressure without support by drugs or other means. Yun yung difference. Okay? So, if you want parang Harvard Report, tas additional sa Philadelphia Protocol ay yung falling arterial pressure. So, when someone is dead, what are the signs of death? So there's cessation of heart and circulation. You have the Magnus test, yung nag-iipit ka ng ligature sa isang daliri, tas yung walang change in color kasi wala namang circulation. Magnus, mag-isang daliri, mag-isa. iCards test, yung mag-inject ka, injection, iCard. Diaphanous, 2 daliri, yung magsashine ng light dun sa web, tapos yung kulay. Application of heat on skin, kasi dapat may vital tissue reaction kapag buhay pa. Siyempre, palpation, etc. Cessation of respiration, pwedeng examination with a mirror, tas kung magfa-fog, examination with feathers, or paggagalaw yung feather, tinapat sa nostril. Glass of water, pwede rin yung Winslow test, yung maglalagay ng tubig sa may chest, tapos yung reflection. Then, you have cooling of the body, which is known as algor mortis. And remember that the progressive fall of the body temperature is one of the most prominent signs of death. Remember that. You also have insensibility of the body and loss of power to move. Changes in the skin, you have your post-mortem contact flattening. So, mafa-flatten yung sides, lalo na dun sa parts na kung saan nakakontact yung body on the surface that it rests due to loss of elasticity. And you have changes about the eye. You also have putrefactive changes. So putrefaction, it's decomposition. So pag mapapanis, napapanis na yung katawan or nasisira na. So you have tissue color changes. So marbleization, it's the prominence of superficial veins with reddish discoloration. You also have evolution of gases in tissue and soft tissue liquefaction. And these are listed here are the factors which affect the rate of putrefaction. So faster, you have internal factors and external factors. So basically the environment. And yung internal factors, yung body mismo. So faster putrefaction kapag mas matanda, obese, or namatay ka from an infection or anasar ka. Slower putrefaction kapag the opposite, mas bata ka. Then actually pag stillbirth, kasi sterile, considered sterile yon. So paglaba, so yung decomposition sa loob ng womb ay hampered. External factors that contribute to faster putrefaction include exposure to free air. Syempre, kapag nahanginan, exposed sa bacteria, etc., mas madaling mag-decompose. Moderate amount of moisture kasi nag-aalaw siya ng growth ng bacteria. Clothing initially by maintaining the body temperature kasi kapag nagpe-preserve ka ng mga pagkain or katawan, pag malamig, mas mabagal yung process of decomposition. So kapag na-maintain mo yung body temperature, mas madaling mag-decompose. Running water kasi pag running water, parang mas natatanggal yung mga bagay. Then external factors that slow down putrefaction, excessive moisture. So excessive, gaano ka excessive? Kunwari, nilubog sa tubig. Yun, mas hindi siya mag-decompose. Clothing, so after, di ba initially na-maintain yung body temperature. Pero after nun, nakakabagal siya kasi napoprotect niya yung body from insects. Tight clothing din, nakakabagal. Still water, so running versus still water, mas babagal yung putrefaction. Then dry absorbent soil, pag nandun yung katawan. Some special modifications of decomposition or putrefaction. You have mummification, yung dinidehydrate yung buong body. You have saponification yan, or adipocere formation. So adipocere, it's the waxy, greasy substance that has rancid, moldy odor. So yan. And yung itsura niya ay soft brownish white substance. Then you have maceration, softening of tissues in a fluid medium devoid of putrefactive microorganisms. So yung mga death in utero, yung mga ganun. Next, duration of death. So, di ba may signs of death, changes in the body after death. So, the presence of rigor mortis, so these are signs that you can use to determine the duration of the death or kung kailan namatay. So, presence of rigor mortis, the average onset of rigor mortis, remember, is 3 to 6 hours after death. It's fully developed after 12 hours. So, kailangan matigas yung buong katawan all over. And it's already absent all over after 24 hours. And its disappearance is concomitant with the onset of putrefaction. You also have the presence of your post-mortem lividity or your livor mortis. So, yung prominence ng mga veins. Yung pag-discolor, yung discoloration. And it develops 3 to 6 hours after death. Same with rigor mortis. And it's fully developed after 12 hours. Sorry, livor mortis, yun yung pooling of blood. Pooling of blood or your post-mortem sugulation. Onset of decomposition. Tropical countries like the Philippines, on average, it's 24 to 48 hours. So again, absent siya, wala nang rigor mortis by then. And the stage of decomposition is affected by a lot of factors na discuss natin kanina, yung internal and external factors. Meron ding entomology, so kapag may maggots, more than 24 hours na, pwede rin tignan yung food sa stomach kasi it normally takes 3 to 4 hours for the stomach to evacuate the contents of a meal. Pwede rin yung amount of urine, state of the clothing, and even chemical changes in the cerebrospinal fluid. So let's go to some different kinds of death. So you have violent deaths. So violent death are due to injuries inflicted in the body by some forms of outside force. And the physical injury must be the proximate cause of death. So meron kayong accidental, negligent, suicidal, parricidal, infanticidal, homicidal, and murder. So let's talk about parricide. Parricide is the killing of one's relative. So remember that for it to be parricide, kailangan yung namatay ay yung pinatay ay yung father, mother, or child, whether legitimate or illegitimate. Okay? Or any of their ascendants or descendants or spouse. So, pag spouse must be, pag spouse or ascendants and descendants, or other descendants and ascendants, kailangan legitimate. Next, homicide versus murder. Remember, both have the intent to kill. Homicide, it's reckless imprudence resulting in homicide. Isa yun. Or pwede rin plain and simple homicide. Pinatay mo lang. Paano siya naging murder? Meron kang aggravating circumstance. So, aggravating circumstances. You have treachery, tinakwil mo, use of superior force. So, may armed men ka, means to weaken, nilason mo, or dinrug mo para hindi siya makapalag. Or means to ensure to avoid impunity, and nighttime to increase chance of success. Ano ba? During any calamity. Or during any calamity, kapag ginawa mo, kasi yung notion ay kapag ginawa mo during a calamity, gusto mo talagang may intent ka na patayin, tapos noon, parang premeditated siya kasi pinlano mo na, para makatakas ako, gagawin ko siya during this sort of time na merong public calamity. Committed in the presence of the chief executive or in the palace grounds, with cruelty, deliberately and inhumanely augmenting the suffering, or outraging or scoffing at their person or corpse. So, kung alam niyo yung Saw movies, yun, yung mga torture, ganon, kasama yun sa murder, in consideration of a price, reward, or promise, or if there's evident premeditation. Let's talk about judicial deaths or yung tinatawag nating death penalty. So, ito yung mga nakalagay sa SOLIS. So, you have your death by electrocution, which at the time was the only method recognized by the civil law prior to the 1987 Constitution. So, remember that physical injuries due to electrocution, yung main cause of death ay shock. Okay? So main cause of death in electrocution is shock. You also have death by hanging, so due to asphyxia or injury to the spinal cord, death by musketry, so ito yung firing squad, and you have other methods. So the 1987 Constitution actually prohibited the death penalty but allowed the Congress to reinstate it for kunwari nagkaroon ng mga heinous crimes, gano'n. So, actually, nung binago yun nung 1987 Constitution, tayo yung first Asian country to abolish capital punishment. Pero, nabalik siya nung 1993 ni President Fidel Ramos. Tapos electric chair yung gamit nun. Tapos after ng electric chair, ginawang gas chamber. Pero noong 1996, binago siya to use of lethal injection. Baka lang kasi magtaka kayo, death by electrocution only method recognized by the civil law. Pero 'di ba nagkaroon na ng lethal injection. So yung statement na recognized by civil law, it was before the 1987 Constitution. By 1996 yung ginagamit na lethal injection. So, death by asphyxia. So, these are all forms of violent death resulting from interference of respiration. So, you have hanging, so suspension of the body by ligature, so may nakaipit sa leeg. Tapos yung weight na ginagamit para dun sa pag-ipit sa leeg ay yung weight of the body. Strangulation, so you have two by ligature. So para siyang hanging pero dapat hindi yung weight ng body yung gamit sa pang-compress ng neck. You also have manual strangulation, also known as throttling. So yung hands yung gamit. So ganyan or dalawa. Suffocation naman, it's exclusion of air from the lungs by closure of your airways. So kapag yung external respiratory orifices mo yung na-close, it's called smothering. Kapag foreign body impaction sa airways, it's choking. Submersion or drowning, basically para siyang suffocation, pero yan, yung submerged kasi siya in water or in liquid to prevent free entrance of air into the airways. Compression, ang nangyayari sa compression ay free exchange of air is prevented by immobility of the chest and abdomen, pwedeng due to external pressure or crush injury. So, an example of this is burking. And actually, natanong din to, burking. What's burking? It's when a murderer kneels or sits on the chest of a victim with their hands closing the victim's nostrils and mouth. So that's burking. And yan, natanong siya. Another kasama din sa compression ay actually crucifixion. Kasi hindi makagalaw ng mabuti yung chest wall. And you have breathing of irrespirable gases. You have carbon monoxide, carbon dioxide, hydrogen sulfide, hydrogen cyanide, sulfur dioxide, etc. So, namatay yung katawan, anong gagawin? Burial. So, isa sa mga pwedeng gawin. Burial. Burial requirements, the body must be buried within 48 hours after death, except kapag may legal investigation, specifically authorized by local health authorities, or it's implied when the body is embalmed. Pag nabasa niyo to, baka ang isipin natin na, paano yung mga nasa mga punerarya? Di ba ilang araw sila nandun? Basta implied na pwedeng hindi 48 hours kapag na-embalm. But the body must be buried within 12 hours if the death is from communicable disease, unless sabihin ng local health officer. So, death certificate is necessary. Remember, it's a code of sanitation requirement, and it should be forwarded to the municipal secretary within 48 hours after death. And permission from the provincial fiscal or from the municipal mayor is necessary kung may violence involved. Remember the burial ground requirement. So, this is based on the sanitation code as well. So, more than or equal to 25 meters from any dwelling house, and more than or equal to 50 meters from outside of a river or any source of water. Okay? So, another thing about death are investigations of death, which include autopsies. So it's it's the examination of the dead body. So indications for autopsies, which includes whenever required by special laws, upon order of the court, mayor, and the provincial or city fiscal, upon written request of police authorities. Remember, written request of police authorities. Whenever the Solicitor General, provincial, or city fiscal shall deem it necessary, and whenever the nearest kin shall request in writing to the authorities concerned. So yung police, saka yung nearest kin, kailangan sinusulat yung request. Hindi pwedeng sinabi lang, pa-autopsy naman po. So, who can perform autopsies? So, health officers. So, as referred to in the sanitation code, pwedeng district or local health officer. Medical officers of law enforcement agencies. Medical examiner of the City of Manila. Medical officer of the NBI. Medical legal officers of the Philippine Constabulary. And just to clarify, Philippine Constabulary, it's the predecessor of the Philippine National Police. So, the medical legal officers of the PNP, yung pwede conduct ng autopsy. So medical examiners of the Manila Police Department, medical legal officers of the NBI, and of course, kung accredited yung hospital, yung members ng medical staff dun. And there are two kinds of autopsies. Remember, you have your pathologic and medical legal autopsy. And they differ in purpose. Yung purpose of a pathologic autopsy is to confirm your clinical findings. So, di ba, may mga clinical pathologic conference. Yun, pathologic autopsy yung ginagawa sa mga ganun. For medical legal autopsies, it's for the correlation of tissue changes to a criminal act. And the requirement for a pathologic autopsy is the consent of the next of kin. But for medical legal autopsy, it's the law that gives consent. And of course, the emphasis sa pathologic autopsy is the abnormal findings. But for medical legal, it's the effect of the criminal act on the body. So, conclusion, as all the abnormal findings sa pathologic autopsy and medical legal, kailangan specific for the purpose, again, of determining the relationship of the death to the criminal act. So kapag meron kang mga minor findings, pwedeng hindi kasama sa pathologic, pero pag medical legal, kailangan lahat. Basta isipin ng investigator na useful siya. So after death, let's go to physical injuries. So for physical injuries, you have this as your legal classification. Mutilation, may natanggal na part ng katawan, ng living body. Serious physical injuries, you're incapacitated for labor for more than 30 days. Then, counted dito are any injuries resulting in imbecility, impotence, and facial mutilation. So, kahit hindi ka na-incapacitate for more than 30 days, basta meron niya mga yan, serious physical injury. Pag less serious physical injury, your duration of incapacity is more than 10 but less than 30 days. And if it's light physical, it's incapacity for less than 10 days. Yung strictly nakalagay 1 to 9 days. Or pwede rin hindi ka na-incapacitate. Or pwede rin hindi ka nag-require ng medical assistance. That's slight physical injury. So tinatanong to, Presidential Decree number 169, it's a presidential decree during the martial law that requires all doctors, hospitals, and clinics to report the treatment for physical injuries. So kailangan daw any medical establishment, any physician, kapag nag-treat sila ng any person for serious or less serious physical injuries, mag-report, i-report yon sa Philippine Constabulary. So, hindi kasama yung Department of Health or whatever, local health officers, hindi, police daw. And the penalties include imprisonment of 1 to 3 years, a fine of 1,000 to 3,000 pesos. Sipin na lang natin kung gaano kamahal yun nung time na ginawa to, and cancellation of the license. But remember, so pag tinanong to actually, medyo makikita mo na nasa list-based or hindi pa updated kasi binago na siya. Inamend siya ng Executive Order number 212 na ang reporting ay sa nearest government health authority. Yun na, nearest government health authority na hindi na sa police. And kapag ang ano na lang is kapag ni-request ng police upon written request, pwedeng ibigay yun ng local health authorities. Yung penalties binago din, binawasan, and yung cancellation of license is after 3 violations. Dati, pwedeng cancel na lang basta-basta. And it's the Board of Medicine that conducts investigations, hindi yung police, yung mag-investigate sa atin as doctors. So yun, sa legal aspect of physical injuries, let's go to a bit more medical. So types of wounds, you have closed and open wounds. Sa closed, pwedeng superficial or deep. Superficial, kasama dyan your petechiae, contusion, and hematoma. So for contusions, remember that the color of the contusion corresponds to, can give you a clue on its age. So red-purple, as soon as it's completely developed, it becomes green after 4 to 5 days, and it becomes yellow after 7 to 10 days. And of course, this is because of the degradation of your hemoglobin na nagiging biliverdin, that's nagiging bilirubin, etc. And its disappearance gradually starts after 14 to 15 days, and ultimate disappearance varies from 1 to 4 weeks. So deep types of wounds, sprain, dislocation, fracture, strain, subluxation, internal hemorrhage. And yung mga open wounds, you have abrasions, gasgas, incision, slice, stab, tinaga, puncture, tinusok, laceration, yan, malaki, like wakwak na incision, hindi naman super, pero malaking incision na hindi jagged, and hacking, as in wakwak. So, you also have antemortem versus postmortem wounds. And one key concept, of course, kapag buhay, gumagana yung katawan. So, ano yung mga functions ng katawan pag buhay? May hemorrhage kasi dumadali yung dugo. So, mas maraming dugong lumalabas pag antemortem yung wound, generally arterial. Spouting of blood, meron kasi dumadaloy pa yung dugo. May clotting kasi gumagana pa yung bodily functions. Edges are deeply stained and then not removed by washing. And the edges gape kasi meron pang buhay pa yung skin and yung muscle fibers. So, yung reaction, nakaka-gape siya. So, nakakapag-contract yung muscles, etc. Yung skin, elasticity, etc. And may inflammation. So, sa postmortem, halos wala nang dugong lumalabas, walang spouting, hindi nagka-clot, hindi na sustain, and yung edges, they don't gape kasi hindi na elastic, hindi na nagko-contract yung skin, yung muscles, etc. And wala kang inflammation. Favorite of the Board of Medicine, gunshots, so gunshot wounds. So these are the parts of a gun, and one thing that they did ask is the caliber, which is the internal diameter, or it's the diameter of the barrel. So nakikita natin dito, sorry kung hindi masyado maganda yung baka may delay, pero makikita natin dito na ito yung barrel. So itong distance na to, itong diameter na to, ito yung caliber. Okay? So yeah. So familiarize yourself with these, with the parts of guns. Next, you have gunshot entrance wounds. So ito madalas din na important na concept. So yung distance ng gun, iba-iba yung presentation niya dun sa katawan. Yung distance ng gun, nung finire yung gun, yung effect ng bullet dun sa katawan, iba-iba. Depende sa distance. So, pag near fire, it's large kasi syempre may sumabog. Mas magiging malaki yung entrance wound. There's a distinct abrasion color. There's a stinging of hair. Nasusunog kasi mainit yun. Meron kang muzzle imprint, blackening of the bullet, carboxyhemoglobin. Tas depende na siya. So for short range, medium range, and longer range, iba-iba yung lumalabas. So for gunshot entrance versus exit wounds, very intuitive yung difference nila. Pag entrance wound, laging meron. Kasi kailangan pumasok para magkaroon ka ng wound. Exit, pwedeng wala. Kasi pwedeng na-lodge inside the body. Size of bullet in comparison to the hole, mas maliit kapag entrance. Kasi pag pumasok siya dun sa balat, syempre mapupul niya yung balat paloob, tapos magko-contract. So, mas maliit. Pag palabas, bubulwak yung balat. So, pwedeng mas malaki siya than the bullet. Than the bullet, yung wound mas malaki sa bullet. So, ganun nga, edges, inverted pag entrance, everted pag exit. So, shape, pag entrance, usually oval. Kapag exit, parang wala namang concrete na shape. Pwedeng stellate, yun nga. So, parang bumulwak na yung balat. Kapag entrance, pwede kang may contact ring. Pag exit, wala na. Tattooing and smudging, yan yung gunpowder residues na tumatama sa balat. So, wala lagi yun pag exit. Kasi nasa entrance yung doon tinapat yung barrel. Yan. So, pag underlying tissues, pwedeng mag-protrude sa exit, and paraffin test, positive siya sa entrance, negative siya sa exit wound. So, speaking of paraffin test, it's a test to determine, to test for powder residues. So, kapag sa skin, you have your dermal nitrate test known as your paraffin test. Remember that it is not conclusive kasi pwede siyang mag-test ng positive with other products containing nitrogenous compounds. Pag sa clothing, ang tawag dun sa pag-test for powder residues ay Walker test. Okay? Walker test. And just, so gunshot wounds, pag burn wounds naman, burn injuries, ginagamit sa SOLIS yung Dupuytren's classification. And ito, another point of contention kung siguro gamitin ng Schwartz. Pero pag tinanong sa legal medicine, ito yung gagamitin natin. First degree, erythema, slight redness, medyo same. Second degree yung may vesicle formation. Third degree, ang nakalagay sa SOLIS ay very painful pa rin yung burned area. Okay? 3rd degree yun. 4th degree, yung hindi na siya masakit. Tapos meron kang parchment-like na skin. Yun yung 4th degree according to the classification sa SOLIS. 5th degree, deep fascia and muscles. And 6th degree, abot ka na sa sub-adjacent tissues, organs, and bone. Let's go to paternity and filiation. So, these are important concepts para dun sa determining heir. Yan. So, and kung parricide ba yung namatay. So, legitimate children, you have legitimate children proper. So, these are children born in lawful wedlock within 300 or within 300 days after the dissolution of marriage. So, basically, pinanganak ka during the time na na-conceive ka during the time na tawag doon? Na wed yung magulang mo. Legitimated children are those that underwent legitimation. So, process by which a child born out of lawful wedlock, so hindi ka legitimate, tas naging legitimate ka by law. So, kailangan natural kang child, kailangan acknowledged ka by both parents, and kailangan may subsequent marriage. So, dito talaga sa Philippines, para maging legitimate kang anak, kailangan kinasal yung magulang mo. Adoption naman, which it's the process na yung relations of paternity and filiation are recognized as legally existing by persons not related by nature. So, hindi mo ka mag-anak, pero by law, meron kayong paternity and filiation. So, what are those, sino yung mga considered na illegitimate na children? So, pwedeng natural children proper bago sila ma-legitimate. So, those born out of lawful wedlock. Natural children by legal fiction, so those born of void marriages or voidable marriages. Meron din yung mga natural children by presumption, so acknowledged by the father or mother separately. Yan. And you have your spurious children. So spurious children are those that are not considered natural. So you have adulterous children conceived during in adultery or concubinage. Sacrilegious children kapag ordained yung parents, non-pare. Incestuous children, blood-related yung parents. And you have your manseers, children conceived by prostitutes. Okay? So, if a child was born 3 months after marriage, it's illegitimate. Pag in-acknowledge by both parents, pwedeng ma-legitimate. Child was born 6 months after marriage dissolution, legitimate. Pero if conceived in adultery, it's illegitimate and spurious. So, kapag yung tatay, pinatay niya yung anak niyang born out of adultery with another woman, ano tawag doon? It's parricide. Kung yung pumatay ay yung legal wife niya, it's just homicide. Tapos pag may aggravating circumstance, it's murder. Okay? So, let's go to mental disturbances and disorders. So, you have malingering. So, malingering, it can be feigned or fictitious or factitious. So, yung distinguishing factor is yung fictitious tsaka yung factitious. So, fiction at may onting fact. So, kapag feigned or fiction, fictitious, pure imagination talaga. Walang factual basis. The injury or disease does not exist at all. Pag factitious, meron naman, pero na-over-exaggerate yung real complaint. Okay? So when do you suspect malingering? If there's a cause for the subject to malinger, parang avoidance of some legal binding consequence, etc. Inconsistency between the injuries suffered from the symptoms not supported with organic lesion, abrupt onset, refusal to be subjected to painful or annoying treatment. You also have disorders of perception. Illusion, remember, illusion is a false interpretation of an external stimulus. So may something there, pero iba yung interpretation. Hallucination, wala kang stimulus. So yun yung, remember the difference between illusion and hallucination. You also have your delusions. So just go through them. Pero remember, hypochondriacal delusion, hypochondriacs, that's the false belief that one is suffering from an incurable disease or parts of their body are non-functioning or that they are not physically capacitated to do a thing on account of a disease. So, hypochondriacal disease. Yung iba naman dyan, very straightforward. Grandeur, persecution, reference, self-accusation, etc. Okay? And Hindi nawawala, nagtatanong talaga sila, phobias. So, just like the sexual abnormalities, nakakatulong yung general and broad knowledge of like root words at etymology. So, ito more Greek, I guess. So, yan. Mga natatanong, marami. Like, yung mga thalassophobia, acrophobia, um, ecclesiophobia, etc. Okay? So, just go through these. Ito yung mga, although ito yung mga topics, yung mga memorize na usually, if you still don't understand the concepts well, it would be best to reserve them at a later day, like during your mastery period. Kasi it might take up effort and space that you could allot to better understand concepts. Okay? So, wag masyadong ma-stress pag nakakita ng mga ganito. Try to allot a different time to try and memorize these things. Next, we go to dangerous drugs. So you have prohibited and regulated drugs. Prohibited drugs, kasama dyan yung heroin, morphine, cocaine, LSD, marijuana. Although siguro ang prohibited drugs, maisip nyo lahat ng mga usual na iniisip natin na bawal na gamot. Pero interestingly, ang shabu ay considered as a regulated drug. Okay, so prohibited lahat ng mga usual nating alam except shabu, which is regulated. And yung pagiging regulated niya, medyo na-mirror siya dun sa penalties kapag meron ka ng possession ng shabu. Banned in sports, yan. Banned in sports, prohibited at all times yung mga anabolic agents, so mga steroids, yan, beta-2 agonists, yan, kailangan prohibited at all times. Diuretics and masking agents, meron ka rin dun sa prohibited in competition and meron kang prohibited in particular sports. Okay? So, basically, kung ano yung makakapandaya sa sports, bawal yun. So, kunwari, tinanong, antibiotics ban ba? Parang hindi naman makakadaya yun sa sports. So, okay lang. So, ito na nga, drug possessions and penalties. Remember, most of them, life imprisonment to death kapag more than or equal to 10 grams. Ayan nga, dahil regulated si shabu, dyan mo siya marereflect Marang mako-correlate mo siya. Okay, regulated si shabu, so medyo hindi siya as bad as yung prohibited. So siya, more than or equal to 50 grams. Tapos meron siya lang yung merong life imprisonment lang. So, life imprisonment, pag 10 to less than 50 grams yung shabu. More than or equal to 500 grams ang marijuana for life imprisonment to death. Then, imprisonment of 20 years and 1 day to life, 5 to 10 kapag yung other drugs. Then, 300 to 500 pag marijuana. Then, yung pag less than those amounts, yung imprisonment of 12 years and 1 day to 20 years. So, very naman. Just try to remember the numbers. So, 10, 50, 500. Tas yung range na ay 5, 300. Yan. So, prohibited drugs, regulated drug. Other drug crimes and penalties. So, use of dangerous drugs. So, pag nahuli ka, pag first offense, it's just rehab. Okay? So, hindi patay. Hindi yun yung penalty mo. Hindi mabaril. Joke lang. Imprisonment of 6 years and 1 day to 12 years pag second offense. Tapos meron ka na ring fine. And if with possession, penalty mo ay yung sa possession. So, use of dangerous drug, kung na-test kang positive, ganun siguro. Ito, loss of S2 prescription copy. Remember, kailangan merong S2 license ang isang doktor para makapag-prescribe siya ng mga regulated drugs. Ngayon, yung process ay may copy dapat syempre, yung original copy nasa patient. May copy for record keeping yung pharmacy at meron ding copy yung doctor. Ngayon, kapag nawala ng doctor yung copy niya, and this is based on a memorandum or basta sa Dangerous Drugs Board to, it's based on a policy by the Dangerous Drugs Board. Hindi siya actually nagkasama dun sa Dangerous Drugs Act mismo. But if you lose your S2 prescription copy because of unintentional lapses or simple negligence, reprimand lang. Pero kapag hindi yon at first offense mo, 20,000 pesos. Second offense mo, 30,000 pesos. Kapag third offense ka na, subjected ka na to the penalties listed in the Dangerous Drugs Act. So imprisonment of 6 months and 1 day to 4 years, and may fine ka na rin, plus suspension or revocation of your license. So again, pag third offense, malala na. Matatanggalan ka na ng lisensya at makukulong ka na. You also have unnecessary prescription of dangerous drugs and unlawful prescription of dangerous drugs. We now go to alcoholism. I think this is the last topic for legal med. So alcoholism, blood alcohol levels, tinatanong talaga siya. Just remember na yung, di ba, sa Solis Dento-based, and pag nakikita nyo, meron kasing 10 milligram percent, tas meron ka nung 0.05 gram percent. So same lang sila. So i-move mo lang talaga yung decimal place 3 times para makuha mo yung milligram percent from yung sa gram percent. So same lang naman siya. Usually yung mga tinatanong dyan, kailan nagsa-start yung mental confusion? So it starts 150 to 300 milligram percent. Kailan ka comatose na, may incontinence of urine and feces? 400 milligram percent. Kailan ka unfit to drive motor cars? It's 0.1 to 0.15 gram percent or 100 to 150 milligram percent. Siguro dahil yun nga, pagdating tingnan mo sa clinical signs and symptoms, 100 milligram percent, meron ka ng incompetency, tapos pag-abot mo ng 150, meron ka ng disorientation, etc. So by 0.1 to 0.15 gram percent, unfit to drive motor cars. And how does alcohol diminish your driving skills? So it increases reaction time. So mas matagal ka bago makareact. Creates a false feeling of confidence. It impairs your concentration, judgment, and integrates your muscular coordination. And it also decreases your visual and auditory acuity. Okay? And that's it for legal med. Last, for ethics. So just remember the 4 basic bioethical principles. Hindi mawawala yan. Autonomy. It's acknowledging a person's right to make decisions, to hold views, and to take actions based on their personal values and beliefs. And we uphold this sa physician-patient relationship by giving the patient the right to consent. Make informed consent. Justice, treat others equitably, distribute benefits or burdens fairly, so kasama burdens distribution. Beneficence, do what is best for the patient, and non-maleficence, do no harm. And just another important concept in ethics, medical paternalism. So these are sets of attitudes and practices wherein the physician determines that the patient's wishes or choices should not be honored. Ako yung doktor, ako yung magaling, wala kang say. Tas nakalagay ito dun sa handouts ninyo, yung 3 types of physician-patient relationship. You have your activity passivity, guidance cooperation, mutual participation. And actually, yung medical paternalism, it's actually more of the guidance cooperation. So basically, the doctor tells the patient what to do, and the patient's role is to cooperate or obey. Activity passivity kasi, it's more of, kunwari, walang magawa yung pasyente. As in like, comatose. Yun, activity passivity yun. So in the past, paternalism was actually considered an absolute medical necessity kasi wala namang access yung public to understand medical procedures and practices. Wala yung silang access to that information. However, in recent years, syempre, mas nagiging knowledgeable tayo as humans, lahat ng tao may access to information, nagiging mas limited na yung paternalism, and blind faith in doctors' decisions has come to be frowned upon. So hindi na to ginagawa ngayon. Not as bad. Hopefully. So yun, that's it for my lecture on legal medicine, medical jurisprudence, and ethics.